Good evening, New Salem. Welcome to Wellness Wednesday. Once again, we're going to get started here in about 2 minutes. We're just going to give you a few seconds to come in and join the room, and then we'll start with our introductions. All right, well, we can go ahead and get started. Welcome back to Wellness Wednesday. My name is Paulette. I am your host. And this evening we have Kiana Stewart, who is a licensed professional clinical counselor, to talk to us this evening about anxiety in our youth and young adults and how they can deal with this during this time. So I'm going to pass it over to her. Like I said in the chat, if you have any questions, feel free to enter them and we will answer them throughout the conversation.
All right, thank you, Paulette. Good evening, everyone. As Paulette said, my name is Kiana Stewart. I am a licensed counselor. I'm currently practicing at Key Counseling, located in Gahanna, Ohio. I have about 20 years worth of experience in the social service mental health field. I have a bachelor's degree in psychology and a master's degree in clinical counseling, and I've been licensed for the past 10 years. So initially when this was brought to me, the topic was to talk about tips for teens and young adults with anxiety and or challenges during COVID-19. However, with talking to Paulette, I thought that it was important to not just isolate it to COVID-19 in the wake of the cultural climate that we're in. And this time right now is probably anxiety provoking for a lot of our teens and young adults. So that's what we're going to focus on. I do want to give a disclaimer that this information is based upon my experience. This is not to be used as a tool to self-diagnose. I am not making any claims for usage of diagnosing any disorders. So let's get right. And talk is innate, meaning that in us, it is the reaction to situations perceived as stressful or dangerous. So our body sends signals when we feel stressed, when we feel threatened, and send us in defense mode. It's often felt when a person feels uncomfortable, lack of control in situations, or maybe even not feeling as though they have control over themselves. Anxiety looks different in every person. It can be that of increased irritability, sudden unexpected panic, shortness of breath, pain in your chest, stomach, butterflies in your stomach, that feeling of persistent worry, fear, this will be frightening fantasies, dreams. It's not an all-inclusive list. Also, heart palpitations, unexplainable body aches or pains, pains in your neck or back, unexplainable headaches, passion or diarrhea, butterflies in your stomach. It could be restlessness or jumpiness, having your difficulty concentrating or having racing thoughts, your mind jumping from one thing to the next. It can also be feeling uptight or on edge. Also intrusive or unwanted thoughts. That's also a symptom. And tired, weak, or easily exhausted. So when we talk about it, it's like, well, that's your average teen or young adult, right? Some of those, especially that feeling tired, easily, and some parents just don't understand, especially when we're talking about teens, because they can't always identify what is wrong. I don't know what is wrong. Something just doesn't feel right. So we're looking at this situation. If you notice a change within the past 2 weeks, kind of consistent, that's when I would say to really kind of focus in on it. If, okay, this has been going on for about a period of 2 weeks or so, this isn't normal, not just, oh, it's happening today, but not happening tomorrow, because that happens for all of us. So that's not necessarily, those are anxiety symptoms, but it doesn't necessarily mean that you have an anxiety disorder. And these things have to be prevalent and impact or interfere with your day-to-day function. There are different types of anxiety. There is general anxiety. There are phobias. There is separation anxiety. So kids kind of not feeling easy with separating from parents or loved ones. Social anxiety and panic disorder. Some of the most common ones. And when we think about the wake of America today, with COVID-19, with the cultural climate, I would not be surprised if there's an increase in the social anxiety. So being in crowds, being in unfamiliar public situations, that could likely increase, as well as the separation. So if a lot of us have been quarantined, youth are still being quarantined, but yet the parent is leaving, you may find that they are panicking about you leaving out, they don't feel comfortable, or the other side is that they could be really unbothered by it. Again, because we're talking about teens. So one of the things that I think that it's important is for parents not to project their fears onto their child. And so then to, oh, well, they feel like this, they're uncomfortable, or, they're having this difficulty breathing. And then I talk to a kid and they're like, no, like there's nothing going on. So it's important as parents, for you to own your own stuff and not to impart on to your kids. Some of the contributors would be environmental. So the things around us, they can cause and increase these symptoms, from the job, school, or financial situations. Especially, I want to kind of take some time and talk about that, especially for our young adults. When we're talking about the personal relationships, the job, financial situations, because you guys have bills too, and, and talking about being furloughed, and talking about, how do you safely social distance, but yet still interact with your peers. It's real, and you are not alone. So it's okay to talk to somebody about it, to talk to your friends, to talk to your family. I think more so than now, because people maybe who have never identified anxiety before, or even depressive symptoms, this has been a time that even myself as a therapist, I've had those moments. And I think it was probably around week of quarantine where it was like, enough is enough. Like, I've had it. I'm tired of being in the house. I'm tired of not being around my friends, of not seeing family. And so that's really difficult. So some tips to try that I talk to some of my clients with, trying to maintain some sense of normalcy, right? What does that look like? What was normal is not normal anymore. And as our stay-at-home order has been lifted, how do we try to safely integrate back into society? So again, making safe choices, definitely not wanting to live in fear, but if you're gonna go out, definitely taking those precautions and having conversations about what this looks like. So, some of us have been out to stores, but I know a lot of parents have kept their teens inside. So kind of slowly introducing them, especially if they're already anxious, and being okay if they're hesitant to kind of re-age. Maintaining contact with family and friends are important. Teenagers, young adults, friends are life. Friends are everything. So this time has been especially difficult. School is a great social outlet for a lot of teens, a lot of young adults. Work is even a social outlet for some young adults as well. So it's important to definitely maintain some kind of contact with family and friends, whether that is virtually, whether if there are no underlying health conditions, if you feel comfortable with social distancing and having some in-person contact, it's definitely helpful during this time. Learning the warning signs so that you can be proactive. So once you understand the signs, you can start to identify. And then once you start to identify, then you can try to implement some tools to kind of help deal with anxiety. Anxiety can come and go. It's not to say that because you are anxious or you're having an anxious moment, or even if you've been diagnosed with anxiety disorder, that it is every day. Have good days, but then, certain situations can impact you differently. And here is that one set of those anxiety symptoms. So learning the warning signs so that you can be proactive, and then having some of these tips, such as mindfulness exercises. One of the mindfulness exercises that that's easy to utilize is to identify 5 things in the room that you can see, smell, taste, touch, and hear. So you're honing in on your 5 senses. So, and what this does is it creates a distraction, because a lot of times if you're dealing with anxiety, you have difficulty controlling your breathing, especially if you're experiencing a panic attack. And so you want something to distract that disrupted breathing. So for instance, talking to you, Paulette, if you were having a panic attack, okay, look at me, right? I need you to look at me. I need you to take deep breaths. We have a desire to close our eyes. So no, I need you to keep your eyes. I need you to look at me. I need you to match my breathing. So I would take breaths and have you match my breathing. And then, okay, tell me 5 things in the room that you can see. So then what you probably won't notice is that the breathing starts to become more manageable. Tell me 5 things that you can hear, that you can taste, that you can touch. And that is something that definitely typically helps when you're dealing with that. Music is a great one. I tell my kids especially now, I don't need you to listen to something that's going to get you all pumped up and get you lit and all of this. I need you something that's going to bring you down. So having a playlist already like developed so that if you feel, again, if you start to recognize the symptoms, okay, something's not feeling quite right, let me put on some music. It's definitely a great distraction. And when the music is playing, if you can identify what are the instruments that are playing, maybe focusing on the lyrics, focusing on the melody, you know, the different parts of the song is definitely a good distraction. Reading is great. Coloring, adult coloring books, child coloring books, color pencils, all of those things. I utilize them for myself. They are definitely great things to help implement and to help kind of give you some sense of groundedness. Drawing and journaling. Journaling is really cathartic. It doesn't have to make sense. You don't have to, oh, well, what am I going to talk about? You could literally start that way. I don't know what I need to talk about. This is crazy. I don't know what's going on. And kind of those thoughts that you've been having in your head, really, you're just trying to flush that out and get them out. And journaling doesn't have to be in a book. You always have your phone. Text it. Text to talk or using your notes, however you need to get it out is perfectly fine. So you don't have to sit down with a pen and paper. It doesn't necessarily have to be quiet. Just whatever works for you. Regular exercise. So walks definitely help. We talk about trying to stay in a routine, but it's definitely important, even of uncertainty, that although we are trying to maintain our distance socially, you can still get out and walk. You can still get out and ride a bike. These things are what we identify as behavior activation. And they definitely help with you being grounded and to help manage anxiety. Let's see, disconnecting from the identified stressors. I know we love social media.
I was just about to ask.
Social media gives us, you know, it can be a great tool for information, as well as the news, CNN, MSNBC, whatever. But sometimes you just got to disconnect because it's too much. And, you know, and I tell my clients now more than anything, you've got to make time for yourself. You've got to make time for yourself because I need you to be able to reset to deal with this another day, because we don't have an end date to this. We don't know when it's going to end. We don't know how long it's going to last. So sometimes you got to disconnect. You got to watch some mindless TV, play some video games, play some games on your phone, whatever you need to do. But like, that's okay. If you identify that this thing is what's causing my stress, then you need to remove yourself from it. So with that being said, parents, sometimes you can be the stressor. So I need you to give your child permission to walk away. I need you to give your child permission to regroup. I understand you want to talk about it, but I want you to imagine as a parent, if your boss, you're already riled up, but your boss is still trying to talk to you. How effective is that going to be? All it's doing is fueling you. And next thing you know, all of those coping skills are out the window and you're ready to pop off. So that doesn't happen. These are just little humans. giving them that opportunity to reset, to walk away, but knowing that we will or we may have to come back and discuss this. But, you know, again, if you are the stressor in that situation, unfortunately, I think that's a tool that needs to be.
Kiana, what advice would you give to individuals who, so while we were talking about social media and we were saying that it's clearly a tool that individuals use to, you know, keep in touch and figure out what's going on and be informed, what would you say to those individuals who know they need to walk away, but walking away causes more anxiety because the fear of unknown, like they don't know what's going on? What advice would you give to them?
So you're going to find out. Somebody's going to text you. If it's something that you really need to know, somebody's going to text you. You're going to find out. It's not going to kill you. And maybe you can't do a long period of time, right? Maybe you can't disconnect for, you know, the whole day. But if I can get you to disconnect for a half hour at a time and then come back, that's still enough to allow you to come back down, like I said, to deal with this another day. So it's not that or nothing. So if you have to start in short increments, start in short increments. I think I already talked about this, but again, parents, you've got to be careful that, and being careful about what you discuss in front of your children, in front of the team. So, right, we're all in this space together. So talking about, you know, the current events, sometimes it's a lot. It's scary. These young people are having difficulty processing through it. So you know your kids. So if this is too much, your job is to kind of shield and protect them. Right, and maybe give it to them in small doses, but every conversation doesn't necessarily need to be had. Being careful with that. Box breathing. Box breathing is another breathing tool. And box breathing looks at taking breaths on the count, deep 4, exhale, release, and doing that again. And what that's doing is helping to control your breathing, helping you to become grounded. Cognition reframes, right? So we know that talk therapy, reframing your thoughts. So if you were to tell me that you're anxious about going to the store, well, let's talk about it. What about going to the store is making you anxious? You know, and kind of dispelling those myths and identifying, you know, what's the worst that could happen? What's your evidence of this happening? What would make you feel comfortable if you just had to go out? What would make you feel comfortable in that situation? So really kind of talking through some things and giving the individual the opportunity to not have the answer. I don't know. Right? So we've got to explore some things together. Those are the tips that I have. Again, basic anxiety is not going to look the same for everyone. It can vary. The one thing as a parent, differentiating that irritability, right? Because teenagers are irritable. So that irritability, that grumpiness, but if it's kind of persistent, it's not necessarily it may not necessarily just be teenage behavior, but it may be something else that's going on. And they may not be able to articulate those emotions. So that's what I have.
We don't have any questions so far. If you have any questions, feel free to go ahead and put them inside of the chat and I'll read them back to Kiana. But we do have a lot of comments about the breathing techniques. They're appreciative of those. And then the main thing that is sticking out to everyone is the information about the permission to walk away. They're all saying how important that is. And I can agree.
And definitely, right, having a village, a network. So having a safe place for you to have your irrational thoughts. So, I have a couple of group text messages, text messaging threads. So there are times where we're in there and this is stupid, where, we're kind of venting and going off, and, it helps to know that you're not alone. It helps to know that, others deal with this, and, just really, sometimes that's all you want. Sometimes all you want is just to fly off the handle and to express some of your frustrations without being judged. So even if you can just be that ear for somebody, or if you have someone that you can utilize for that, it's definitely helpful.
We would like to know, what age groups do you counsel, and are you accepting any new clients?
So I personally do, I don't do any younger than middle school. My youngest client has been 11. My oldest client has been 72. So I'm everywhere in the middle. I am kind of accepting new clients. It's definitely on a case-by-case basis. You can find my bio on keycounseling.org. And my direct email is q.stewart@keycounseling.org. Everything right now is telehealth. So everything is virtual, and that is difficult. I think more difficult for when we get into the middle school. But I do currently have high schoolers and some of my college students, as well as adults, that can effectively do the telehealth.
Is it recommended to contact you for trauma cases, or is there somewhere else we should direct individuals?
So if you're looking for something trauma specific, again, let's talk about it. Email me. We can definitely, if not, I do have a network of other therapists where I can direct you to, but it's really not a blanket yes or no. So I'd rather, again, have it taken as a case-by-case basis.
Do you have any tips for stressors in the workplace, given the recent climate of the culture right now?
Oh, again, know your limits, right? Be okay with walking away. Be okay with saying that you don't feel comfortable having this conversation. Actually, I have a friend in HR, and she was stating that she actually recommends to kind of avoid the conversation because it could go left or right. So if you don't feel comfortable having the conversation, right, I think being able to express that. I'm not in a place, I'm not in a space to have a conversation with you. It's also not our responsibility. This is personal, right? This isn't Kiana the therapist, but this is Kiana Stewart. It's not our personal responsibility, to educate everyone on Black America, because you can only speak for yourself and for your village. You can't speak for, an entire race. So I think it's being okay to verbalize that. I don't know how many people are back at work yet. So it may be a little easier for those that aren't in a confined workspace to kind of dodge or to disconnect from the stressful work environment. But I definitely think taking time, music, right, to help with stress. If you're in your cubicle, if you're in your office, exactly, the ear pods. If you need to journal some stuff, right, emails, put it out there and erase it, right? Because that first draft is probably not the one that you want to send. So, implementing some of these same tools for yourself, taking time out to get up, to walk, to, leave the office, leave the situation, to come back. Personally, for me, Sometimes prayer is all it takes because, you know, we can be a little slick with our retorts. So sometimes you just, you know, have to ask for some anointing of your tongue.
Do you partner with physicians in case like your clients or patients need medicine
Um,
prescribed?
we have had a partnership with Urban Pediatrics, but with medication, with some of your lower level medications, so for anxiety, depression, you can get that through your PCP. So through your primary care physician, they are definitely have the ability to write you a prescription for medication. With medication, what I want to say is it's just like any other medication that you would take for blood pressure, for diabetes, for heart. That first prescription may not work. It may not be a best fit for you. So know that it's a possibility that it doesn't work and that you may have some adverse symptoms, but that doesn't mean that there's not something out there that will work for you. So be careful that you're not like, oh, well, that didn't work before, so I'm not going to try it again. Also, medication is not the magic pill, right? So medication in itself is not necessarily going to help. So I definitely think it is that balance of medication and some therapy, along with the implementation of some skills to help kind of manage your mental health.
Well, that was the last question. If anyone has any other questions, feel free to drop them in the chat. And while they're doing that, if you have any other updates or any final words to bring us to a close.
You're not an anomaly, right? So this is not solo. It's not the expectation that you have all of the answers, that you have to deal with anything that is discomforting alone. There are people out there that are willing to help you. Like I tell my clients all the time, your informal supports, they can only support you if you let them know that you need the support. Sometimes we like to package things and be so poised and well put together, but on the inside we're crying, but nobody knows. But I can only help you. I can only help you if you give me the information. And that's even as a therapist. I tell my clients I cannot and I will not work harder than you. So we'll go as fast or as slow as you want to go, but you have to be willing to do the work. I only can go off of what you tell me. So if you come in with this controlled narrative, then, you know, that's what it is. So some authenticity is definitely necessary.
Do you have any referrals for group support?
Yes, I know actually Ezekiel Peoples is doing a male group right now that I think he just started or is getting ready to start. So,
and I believe he's watching right now. I think he hopped on. Ezekiel, okay. If you're still on, put that information on there.
So I'm gonna give you his email, which should be like mine. So it should be e.peoples at keycounseling.org. So I know he's doing a male specific group right now. As far as other groups, I'm not quite sure, but I know that he is doing that group.
And then I have a question for, so I know that there's two types of counseling or therapy where there's short-term and then there's long-term, correct? Is there anything that you suggest for, you know, our youth who are going or who have anxiety right now, especially for their parents who are looking to seek help for them?
I think that, again, it's a case-by-case basis, right? So people, you know, clients can come in and feel as though that they'll only need, you know, I've had people that say, oh, you know, I only need about 5 or 6 sessions. And, you know, here we are a year or 2 years later. So, you know, if you feel the need, I wouldn't be so stuck on the time frame, but just seek out the help, definitely. So seek out the help and let the professional kind of determine what your length of treatment is.
Oh, great. And Ezekiel is our upcoming guest, so
Perfect.
tune in for him next week or
All right.
soon. Well, thank you so much, Kiana. We really appreciate you coming on here and talking to us and giving us all these wonderful tips. So we plan on implementing them soon. Thank you again.
Thank you so much. And if there are any other questions, Paulette, just feel free to forward them to me.
I got one more question, actually. It just came through. Hold on one second. Let me open it up. Should couples that are dealing with trauma from current racial tensions seek counseling together or separately, since their challenges may be different?
Couples therapy is definitely unique, and I think every therapist will deal with it differently. Me personally, and depending on where we are in treatment, I may recommend that we break up. So I have some that I will see 1 week, I'll see maybe the husband 1 week, the wife another week, and then maybe a third week we meet together. Okay. So it doesn't, you can kind of figure that out. I think going together is fine, and kind of presenting your problems and then figuring out as a team what the best treatment course will be.
Wonderful. Well, thank you. You're getting a lot of thank yous inside of the chat right now. So we really appreciate you. Have a wonderful rest of your week.
All right. Thank you, Paula. You've been great. Bye-bye.